Hi, I'm Dr. J. Dunn, and I wanted to speak to you about the upcoming FSOMA course that I'll be teaching on genetics and brain chemistry. And I think this may be some new concepts to you and to the world at large. The whole idea that our genetics can have an effect on our brain chemistry, that it can lead to depression, anxiety, OCD, ADD, addictions, PTSD. Genetic variants can increase the risk of those particular conditions. And so I wanted to show you how genes work and how us inheriting certain variants can lead to increased risks of those things, and sort of give you a primer on genetics and biochemistry, and then lead you further into understanding how you can change the expression of those genes. So it's not a boy sucks to be you kind of thing. There is so much that we can do by changing diet, lifestyle, supplementation, acupuncture, chiropractic, all the natural healing techniques that we do actually change our genetic expression. We're doing much more than affecting the physical body, but we're affecting how our genes affect our mood and our physiology. And so I'm going to show you how that all works, and then introduce some specific techniques, including some kinesiology techniques where you can determine where certain genetic variants are affecting this person and how to work with that, and using certain nutrients, again, diet and lifestyle changes that can modify brain chemistry. And so in the lecture, again, we'll be diving into genetics, we'll be diving into biochemistry, we'll be diving into kinesiology a little bit, and then we'll be looking at how getting your genes tested or getting your patient's genes tested can give you a great deal of information about, what's going on in their physiology and their brain chemistry. In my practice, I was in practice for 35 years, or 32 years, actually, in Albuquerque, New Mexico, and I had a great deal of success using these techniques. In my practice, I'm a chiropractor, but I also do emotional work. I do nutritional work. I've studied functional medicine. I use EFT. I used a lot of different techniques. And for me and for many of my patients, I felt like we were missing a piece of the puzzle. And, I kept looking for what's missing here. And, aside from, of course, the energy techniques that acupuncture can bring to the table, for these people, nothing seemed to work. And for myself as well, I struggled with my own depression for many, many years. When I started to look at the genetics, I got my genes tested and put them through sort of a template, and found out that I had a genetic variant in a gene called the vitamin D receptor. So with this particular genetic variant, I couldn't absorb vitamin D correctly. And I will show you how vitamin D is critical for the brain to make serotonin and dopamine, which are two of our main neurotransmitters. And once I learned how to work with the genetics and started taking the correct cofactors for my specific genetic variants, my brain chemistry turned on. And for the first time in my life, I felt happy. Excuse me. So what I want to do is show you how that all works, show you how you can use genetics and biochemistry in your practice in association with the other things that you do that balance brain chemistry as well. Together, that can be a very powerful healing modality to kind of add to your own, what you already do in those arenas. So I look forward to speaking to you at the FSOMA conference and meeting many of you. Thank you.